Hi, I'm Paul Conrad, physiotherapist from the Westhill Physio Clinic, and today's video we're going to talk a little bit about frozen shoulder. So frozen shoulder, what is it, how does it occur, why have I got it, and really what are the treatment options and how can physiotherapy help you, and if pain isn't really getting any better, what can you do about it? Okay, so this is a really common condition that we see patients come into the clinic with, and there are different type of presentations that will give rise to having a frozen shoulder. So first reason is it can be triggered by an overuse or an injury. So for example, I had a slip, trip, fall, fell onto my shoulder. That can be a reason why I would then go on to develop a frozen shoulder. The second reason is what you'd call an insidious onset. In other words, I haven't got a clue why it's there, it's just something the body's done. Unfortunately, it's one of those curveballs that life throws at you. It was nothing that you specifically did, it was just going to happen anyway. So the etiology of it tends to affect more women than men. Again, research says don't know why, but it just tends to affect more women than men, and more sort of middle, so maybe sort of between this sort of in the sort of 50s, 60s age bracket. Kind of the bad news is it also suggests that if you've had a frozen shoulder before, you're more susceptible to getting one potentially on the other side. Again, don't know why that is. So what really happens when we have a frozen shoulder? What's going on, and how do you know if you've actually got one? So the first thing is that the condition is very progressive, it's very, very slow, and there's 3 stages. So stage 1 is what we call the kind of the painful stage. You'll start to notice that you're getting a bit of pain in your shoulder. And again, you said you may link that to a previous injury or trauma, or you may have just found that you have no idea, but your shoulder just started hurting for no apparent reason. And what you'll find over a period of time in this painful stage is exactly that. The shoulder is getting really quite painful. You may find that trying to move your arm and sleeping may become affected. Stage 2 is what we call the freezing stage, and really what's happening here is that the pain is still present, but you actually start to lose range of movement in the shoulder, and quite commonly people will notice that their ability to put your arm in the coat, arm behind the back if you're a lady, fastening your bra, washing your hair, just everyday functional things become a little bit more restricted, and you may find that initially the pain settles down, but if you try to reach out, the pain can be really quite troublesome for you. And so this kind of is very slow. So if you wake up in the morning and you've got a really stiff shoulder and you didn't have it the day before, chances are you haven't got a frozen shoulder, okay? So it's very slow, very progressive. Stage 3 is the unfreezing stage, and as you would expect with the unfreezing stage is you generally start to get regain your function and regain your range of movement back, and in conjunction with that, obviously, your pain will reduce down. So they're your 3 stages, either driven by trauma, or it will be secondary to just an insidious onset, no idea really why that occurred. So our understanding of what goes on in the shoulder, they call it frozen shoulder because it's exactly that, you have a very stiff and painful shoulder. It's also medically was termed adhesive capsulitis, and more recently it's been relabelled as constricted shoulder syndrome, on the background that they didn't find any adhesions in the shoulder, so they decided not to call it adhesive capsulitis. But we won't get too hung up on that, it is what it is. So the pathophysiology of it, what goes on in that shoulder joint, so it affects the capsule around the shoulder joint. And really, if you think like the capsule, it's there to stabilise the shoulder, and it's got quite a couple of pouches in it, so it's kind of like concertinaed in places. So as you move your arm, those sort of undulations in that capsule unravel, allowing normal movement to occur. But with a frozen shoulder, the thought process is that there's a thickening of that capsule, and therefore if you think of something that sort of thickens and kind of adheres, I suppose, to the head of the humerus here, then that's going to restrict range of movement. And so that's really what goes on here. Unfortunately, so once the process is started, there's nothing you can do to stop it. It's going to happen. So how do we diagnose it? So firstly is on the history. Patients who have a frozen shoulder will give a nondescript region of pain. So with other pains in the shoulder, people might go, well, the pain's just here, or it's here, or it comes down the back. With a frozen shoulder, it's much more generic. It's much more, I feel this sort of pain here. Reaching out activities become painful, can be like a sharp pain, and people can also have quite a lot of sleep disturbance, because inside this little space here, things can become entrapped and inflamed. So there's something called the subchromial bursa or the subdeltoid bursa in here, quite often because of the stiffening in the shoulder that actually compresses that, and that becomes painful. So it's really common to get secondary problems with a frozen shoulder as well. So you can start to get impingement of some of the tendons in the shoulder, so you can have a secondary impingement, but the primary reason you've got an impingement is the frozen shoulder. The bursa become inflamed, as I've just mentioned, and that's a secondary problem. So it's a pretty miserable condition to have, and what you would typically diagnose is that these patients have limitations in forward elevation of the shoulder, so when they're coming forwards. Certainly will be lateral rotation will be restricted and potentially painful compared to the opposite side, and a limitation of internal rotation of the shoulder, so hence why patients really struggle to get your arm behind your back. Everybody can present slightly differently with this, but certainly if we suspect that a patient has a frozen shoulder, obviously what we will need to do is normally refer them back to their GP while they're having some treatment here, to request that they have an X-ray. The gold standard to diagnose frozen shoulder is to have an X-ray, just so you can rule out any other reason for why you might have stiffness in the shoulder. So if someone comes with a frozen shoulder and they have an X-ray and it shows that you've got some marked osteoarthritic changes in the shoulder, that could be a reason why it's stiff. Therefore you haven't got a frozen shoulder, you've got a degenerative shoulder. Or there may be a great big piece of calcium stuck in your shoulder, for example, and that would make it stiff too. So that's the reason you've got a stiff shoulder, and it's not the frozen shoulder itself. So normal X-ray, limitation of flexion, lateral rotation, internal rotation, with a nondescript distribution of pain, and it's come on very, very gradually. You've got a frozen shoulder. Okay. So what can we do about it? Well, in terms of physiotherapy, really it's trying to sort of restore function. Unfortunately, there's kind of good and bad news with the frozen shoulder. The good news is it's a self-limiting condition. It gets better all by itself. Okay. The bad news, unfortunately, is it takes a lot of time. So this really isn't a condition for the impatient patient. You will typically, well, the textbooks can say anything from 18 to 24 months. Okay, it's a self-limiting condition. It will get better, but we can actually start to encourage some movement back. Then the likelihood is it will restore function probably a lot quicker than if you didn't try and sort of mobilise the shoulder. In terms of pain, some patients come in, they are in a lot of pain with it. They're not sleeping, they're not getting any respite from the pain during the daytime, and really in this situation, and really the evidence-based care pathway for that really is injection therapy. And there's two types of injection they do. They do a glenohumeral joint injection, which is typically taken from the front of the shoulder, and they inject a steroid, trying to get it into the actual shoulder joint itself. The idea of the steroid is to reduce inflammation. So if we can reduce inflammation, it's normally mixed with a local anaesthetic, and that would be useful to reduce pain. Or typically you can have something called a hydrodilatation done, which is typically under the care of a consultant, upper limb specialist, and quite often they would refer you to a musculoskeletal radiologist, and they tend to do something called, so basically like a high volume injection. So it's still a steroid, but it's a high volume of saline injected into the shoulder joint, quite commonly under ultrasound guidance. And the idea is someone stretch that capsule, and it's there to give you a bit of a window of opportunity to get that shoulder moving a bit better. So the patient's got a lot of pain. Tend to find that physio struggles to try and settle your pain, but we're great at getting the shoulder moving again. Refer you on to get the injection done, and then you come back and we get the shoulder moving. So what can you do yourself? So if you one of those people that you suspect you've got a frozen shoulder, yes, it's going to be painful, but the pain is manageable. Then what can you do to try and get this going yourself? Because as I said, sometimes you don't need loads and loads and loads of physiotherapy for it. You just need to know what to do, and that's what today's video is all about. So it's really what we call active assisted exercises. There's tons of different ways that you can do this. Respect the pain. What you want to do is move the shoulder into a range of stiffness, but don't force it through pain, because it's just going to give you heaps of discomfort afterwards. So when I say active assist exercises, I said there's lots of different ways you can do it. You can either get the shoulder moving by using your opposite limb, so you're trying to sort of move the arm up into a restricted movement. You can go on to something like amazon.co.uk or for friendsacrossthepond.com, and you can get something called a shoulder pulley, which basically hooks over the top of your door, and it's on like a piece of rope, and you can use that to sort of mobilise the shoulder. So if my right shoulder was the painful one, I may use the pulley to help assist movement on this side. Other than that, we can use something like a walking stick. So just grab this. Doesn't really matter, doesn't have to be a walking stick, golf club, whatever you can get your hands on. So if I wanted to try and increase my external rotation of the shoulder, I'd hold the stick, keep your arm by the side, and you can use the stick to try, if my right side was a painful side, use that to try and pull out. If you try and get your arm behind your back, you just bring it behind you, hold there, and again, just like you're drying your back with a towel, you can try and pull this up here. And we tend to find saying that the rotations tend to come back in the latter stages, in this unfreezing stage, so don't be too concerned if it's very, very gradual, okay? That's really normal. Trying to get your arm up in front of you, again, this is quite tough because obviously I'm trying to fight gravity, so quite useful if you ever lie down on your bed. Now I can go against gravity, it's a lot easier, so my right arm is my painful side, and I'm just going to let that come back as far as I can. Okay. You can also use it to push out to side, so just for purposes of the camera, so say my left arm was my painful side, I can then start to help assist my arm up this way. Now, we don't need to be too prescriptive with these exercises. What's the best way I tell my patients is say that, listen, you get out what you put in, be respectful of the pain, little and often. Okay, so if you've got a spare few minutes, you know, do something that's going to get your shoulder moving. Okay, now you might not have a walking stick to hand, you might not have a shoulder pulley to hand. Okay, but you could hold on to your worktop or something like that and walk your arms away. That's still facilitating shoulder elevation. Once you start to get a bit more movement at back, then we'll start to introduce some strengthening exercises. Again, really important that you don't get any pain. In most of some of the other videos, remember, pain suppresses muscle action, so just be mindful of that. So it's all about trying to keep yourself relatively comfortable, gently mobilise that shoulder, get it moving, and that's what we'll do here at the clinic. We'll use various techniques just to try and help facilitate more movement. The shoulder girdle is quite a complex structure in its own right. So remember, just got the shoulder joint we'll look at how the scapula is moving, which affects the shoulder, look at what your thoracic spine, your ribs are doing, that's basically in terms of thorax and how that impacts on here. And we just try and get things a bit more comfortable moving for you, as long as pain is not your primarily complaint, of course. So what you want to do is you want to do these exercises little and often, and just be aware that it is a slow condition to resolve, but it will get better, so don't worry yourself about it, okay? And you'll find that your function will gradually return. So it's not like you'll wake up one morning and you'll be able to move your arm about as free as you did the day before, but over a course of weeks you may just find things are a little bit easier than they were before. You may even sort of surprise yourself that you would just reach for a cup and that was a lot easier, and you may catch yourself thinking, well, actually that was a lot less painful, a lot easier to do, and that's basically, things will just get a lot better with time. So I hope you found that video useful. Do check out our other videos. If you want any more information or you want to come into the clinic and see us guys, our website is www.westhillphysio.co.uk. Also check us out on social media. We're on Facebook, Twitter and Instagram. Thanks for tuning in today, and look forward to seeing you on the next video.